Good afternoon. About an hour ago, the governor, in a joint appearance with Dr. Anthony Fauci, confirmed that a UK variant case had been detected in the state of California. And I can confirm that that case is, in fact, in a patient in San Diego County. A 30-year-old man with no travel history started developing COVID-related symptoms on the 27th. He was tested yesterday on the 29th around 10 a.m. The results came back in COVID positive around 5 p.m. Thanks to the incredible work of the Search Alliance and Dr. Christian Anderson, who you'll hear from in a minute, they were able to process that result and knew in the early morning hours this morning that this individual does in fact have the UK variant strain of COVID-19. Because there is no travel history, we believe this is not an isolated case in San Diego County, and there are probably other strains, other cases of the same strain in San Diego County. And while it's been pointed out that there is not yet evidence that the strain has any more severe symptoms, there is significant evidence that it does spread considerably faster, that it is much more contagious. And so because of this, along with the significant increases in cases we've been experiencing in San Diego County, the tremendous strain on our healthcare system, which we've been documenting and sharing with you for weeks, because of all of these factors, we continue to encourage the public and plead with the public to please come together, especially over the next 72 hours and the New Year's holiday, to please follow the public health orders. Please avoid the temptation to go about things as you normally would around this holiday season. We have to come together as a community, and we have to take decisive action to slow the spread in our communities. And so we continue again to ask and request, out of a sake to save lives of those on a day we have one of our highest totals in number of deaths, to reduce the strain. We've talked at length about the tremendous burden being borne by our frontline healthcare workers and our ICUs, the number of cases, and out of a desire to get these cases under control so we can begin to resume aspects of our life. We continue to implore you. We have seen a number of entities that are advertising New Year's Eve parties, advertising they want to party like it's 1999, but it's not 1999, it is 2020. And in 2020, we face a global pandemic. And so we need everyone. It isn't every New Year's Eve forever. It's just this New Year's Eve. Please take this serious. Please understand the situation we face, and let's find a way to come together as a community. In a minute, you will hear from Dr. Christian Anderson at Scripps Research. It was his work that uncovered this strain. In San Diego County, we have an incredible Search Alliance, a combination of Scripps Research, UC San Diego, Rady, Children's, and the County of San Diego, along with others who participate in examining and looking at these cases. And while it is a small number of the total positive cases that get examined in San Diego, we believe we have one of the most robust efforts of this kind in the country, and we're incredibly grateful to Dr. Anderson and his team and everything that they are doing. Before we head to him, one quick update. There have been a number of questions around issues of vaccine distribution and the sequencing of that and the process of that, and I just want to very quickly share with you that a lot of entities receive vaccines directly. From a county public health standpoint, our primary role is to try to serve as an air traffic controller and try and guide those, but a lot of entities are getting them. Health systems get them direct, Department of Defense gets them direct, CVS pharmacies get them direct. There are a number of entities that do this, and while we all, in the County of San Diego as well, and while we all work to administer and provide those vaccines consistent with the guidance that's been put out with the tiers and ranking type system, there is some work left to do to make sure we have a collaborative and coordinated region in terms of moving forward in this. There have been some reports of a system that had some that were nearing expiration, and they made the correct decision to not let them be wasted in administering those to individuals whose tier we were not yet at. But as we move forward, we are continuing to work, and our public health officer sent a notice to all of the healthcare systems about the incredible need for us to coordinate so that if there is excess, if there are unused ones, if there are ones that are nearing expiration, that we can share them across systems and be collaborative to make sure that we hold fast and hold consistent to the tiering system that's been outlined of the order and sequencing in which we need to go. And we appreciate their cooperation and coordination in this very difficult area, and we will continue to share with you all of the information that we have as it relates to vaccine distribution processes. And then lastly, before we hear from Dr. Anderson, we know it's been a very difficult year on our businesses, particularly our small businesses. At the county, we've worked hard to provide tens of millions of dollars of grants and assistance and relief to those that have been impacted. And I just want to share that our efforts in partnership with the San Diego and Imperial SBDC Network and the San Diego Foundation has been working in a variety of programs. And we want to let you know that thanks to a program from the state of California administered by these entities, there's $500 million in grants that are now available to businesses that have been impacted from the COVID restrictions. Applications are now open. The deadline to apply is January 8th, 2021 at midnight. Grants are to cover business expenses for those hit hardest by the pandemic. To apply, you visit careliefgrant.com, careliefgrant.com, and you can follow the prompts on screen there to be eligible for the $500 million in grants that are designed to help us with our businesses here.